In the scenes to follow, our group portrays the 4 different communication styles of thinkers, sensors, intuitors, and feelers. Throughout the scenes, we will highlight positive and negative traits for each. The case scenario is Susan is a 32-year-old woman coming into the outpatient surgery center for a breast biopsy. Her mother died 3 years ago from breast cancer. Susan sits in the waiting room with her husband and is obviously nervous, staring unblinkingly at the wall, tapping her feet and wringing a tissue in her hand. You are the preoperative nurse and approach Susan to introduce yourself and bring Susan back to prepare for surgery. How will you establish a therapeutic relationship with Susan? Susan?
Hi.
Hi, I'm Nurse Thinker. Nice to meet you. Hi, Nurse Thinker.
Nice to meet you.
How are you guys today?
Really nervous.
Yeah. Well, why don't you follow me into the prep room?
Alright. So what's gonna happen during surgery?
Don't worry, you'll be fine. There's nothing to worry about. We can talk about that when we get to the prep room.
Okay.
So why don't you guys take a seat and we'll talk about what's going to happen. Do you have any concerns or questions about the procedure?
I'm just really nervous. My mother passed away 3 years ago from breast cancer and she had a horrible experience.
Oh, really?
Yeah, I was with her through everything and I don't want it to happen to me.
Yeah, I wouldn't worry about that. You're going to be fine. The procedure will go well and you're not your mother, so you don't know that that's going to happen.
I'm just scared. Can my husband come with me?
No, it's strict policy that no one else can come into the operating room.
Are you sure I can't come?
Yes, if I did it for you, I'd have to do it for everyone else, so I can't do that. So Susan, why don't you come with me into the operating room?
Good luck.
We'll get ready.
During the scene, we are trying to portray a communication style known as the thinker. There are positive and negative aspects to how this nurse communicated with her client and client's family. Some positive actions made by the nurse include eye contact, which is an important nonverbal communication skill. It's also important to acknowledge the audience, to observe, assess, and respond to everyone in the room, not only to the client. The nurse also portrays a thinker through enforcing policy rules when not allowing the husband to enter the operating room with the client. The nurse is also very businesslike by her personality. She also hurts the client's feelings when she minimizes her concerns and feelings about her mother's history of breast cancer. Some negative actions include the no use of silence when the client shows her concerns about her breast cancer. The use of silence is very important when trying to be a supporter, which is key in nursing. The nurse also minimizes the client's concerns because she doesn't give empathy when the client reveals her feelings. She also gives false reassurance when the client tells her she's going to be fine, even after her family history, when no one knows what will really happen.
Susan?
Yes.
Hi, I'm Nurse Spencer. I'll be taking care of you today.
Hi, how are you?
I'm great. How are you? So, we need to get going right now because there's a long line backed up for this operating room and I don't even want to begin to tell you what kind of day I've had. You're my last patient and I don't want to deal with my kids when I get home. So, let's just get this show on the road.
Excuse me, Nurse Spencer. Can I talk to you?
Excuse me 1 second. Sure.
What's wrong? She's being insensitive. She didn't even ask if I was okay or how I was feeling. I'm very nervous.
I'm so sorry about that. I have the chart filled out perfectly. I'm sorry, is there something wrong? Are you feeling okay? Are you nervous about anything?
I'm really nervous. My mother passed away 3 years ago from breast cancer, and I'm nervous I'm going to have the same experience she did, and it wasn't very well.
Alright, well, I'm sure everything will work itself out. Let's just get going and we'll start the procedure and we'll just go from there.
It's going to be okay.
Alright, come on. We're pressed for time.
This time, the communication style being portrayed is the censor. Positive aspects of Nurse Censor include her ability to get things done and make very quick decisions. However, in this scene, we see many negative characteristics as well. After quickly introducing herself, the nurse goes on about her personal life and shows no concern or empathy for her patient's concerns. She is in a rush, showing the impatient character of a censor. The nurse even snaps at Susan when she is parting with her husband. All in all, Nurse Censor needs to be more sensitive to her patients.